Meghalaya Health Minister Dr. Mazel Ampareen Lyngdoh has raised concern over the growing number of HIV or AIDS cases in the state. Over 10,000 people have tested positive for HIV, with 396 recorded deaths and 785 individuals currently refusing treatment. The minister was speaking at a press conference during the formal handover of an outreach vehicle to the Meghalaya State Network of Positive People, where she stressed the need to remove the stigma surrounding HIV or AIDS and urged the public to face the issue directly. According to the minister, 9,421 out of the over 10,000 people diagnosed with HIV or AIDS are receiving treatment, while 785 have declined medical care. Since the state began keeping records in 2008 and 2009, a total of 396 deaths linked to the disease have been reported.
HIV/AIDS is not somebody else's problem, it is our problem. We begin with this positive note saying that we shall not disadvantage people living with HIV/AIDS. We shall not make their lives harder by isolating them from mainstream community and society. We must make sure that these numbers which are growing in the state of Meghalaya are attended to. Approximately 10,000 plus people as of today. Out of the 10,000 people, 9,421 are undergoing treatment, 785 are refusing treatment. We are looking at this number of people who die because of HIV/AIDS. So when we compare, we now have a data. This was something which was not available in the state at one point of time. About almost 2 decades ago, we did not know how to deal with it, but now we have the data. We are coordinating between the Directorate of Health Services, the Directorate of MCH and the Directorate of Research. Each of these directorates have to coordinatedly put in an effort. Research has to handle the research. Who and what will this research look like? Are we researching only at medical treatment, or are we also researching at dealing with societal issues related to HIV/AIDS?
Lyngdoh also highlighted the connection between high-risk behavior and the rising number of infections. To address the situation, the state government is developing a comprehensive HIV or AIDS policy based on the current ground situation. The Meghalaya AIDS Control Society, church groups, sports bodies, and NGOs like Meghalaya State Network of Positive People are key partners in this initiative.
Today, with drug addiction becoming a big problem in the state of Meghalaya, that is also directly linked to the HIV/AIDS. So we will work with with the Department of Social Welfare. We will work with the DREAM project. We have constituted a committee which is synergizing together. We will put in our efforts together. We will have a combined approach of a policy which will involve everybody. So then we also have to attend to the important problem of people not testing, looking at the problem of commercial sex workers. You cannot hide or deny any longer. It is one thing to get on a moral ground and judge, but it's another thing to get around how do we deal with this, because it is rampant in the community. Gone are the days where you can isolate yourself and say, I'm washing my hands. We are going to address this problem. And we are telling people that HIV/AIDS is no longer a taboo. It is a problem to be dealt with. We will break up this problem. We will look at what needs to get done, and we will leave no stone unturned.
During the event, an outreach vehicle funded by the Speaker of the Meghalaya Legislative Assembly was handed over to MSNP. The vehicle will be used for emergency response, patient transport, and outreach services in remote areas.
Recently, we have very extreme cases in both in Joy, Gentia Hillside. One is a positive pregnant woman. She's having 5-year-old daughter, and her family has kicked her out, and she has no place to go. So our CLH, outreach worker, they have put her into the MCH hospital, and she's 7 months pregnant. So it was really heartbreaking for me and our team. We could not do much, but we just handed over some few amount of money. She could not even have food for her child. She gave her child even to the neighbors only. And the child was looking out for her mother. And when I heard from her own mouth, from her own words, it was really touching my heart. I could not do much. And likewise, there is another lady from Clarion side. She also, this one was from the Clarion side. The other one is from Jawai side. And she also is bedridden. She became an LFU. She could not come out. That is why she has become LFU, lost to follow. And she had also a child 7 years old. So we were planning and thinking how to go and pick her up and do all the necessary tests. So in this kind of situations, we cannot hire this thing. So many cases like that we have come across. So I believe that this will be helping us to reach out such clients or such of our communities.
Don't forget to like, share, and subscribe to EastMojo. For any queries, put them down in the comments section below and press on the bell icon for notifications.